Meow. Hi guys, Dr. Sammy here with Eastwood Animal Clinic, and we're going to talk about some feline things. So, had some questions here lately from some clients, and we're going to kind of address that with our geriatric kitty cat. So, some of the things that you want to look for in these guys is some of their common problems. So, in my experience, most feline patients, if they live long enough, so usually into their teens, but we do consider them geriatric patients once they get past 7 to 8 years of age, and then genetics will play a role and different things like that. So most of my patients will be in the double digits, anywhere between 10 and 20, and I have had some break into that 20 plus category. I think the oldest one that I personally have ever dealt with was 26 years of age. And I had an owner once tell me a dog made it a little bit longer, but they didn't have any medical records to back that up, so don't know. So geriatric felines. And two of the biggest things that we will commonly see develop in these guys is kidney disease, and they do like cancer. The most common cancer that our geriatric feline patients will get is lymphoma. And there's pros and cons with that. You know, there are a lot of different types of cancers. No cancer is a good cancer. Lymphoma is not the worst cancer that we deal with. There is a percentage, numbers may be changing a little bit. The last numbers that I've heard were 80% of lymphoma feline patients have what's called the B-cell lymphoma, and they tend to do very well with treatment. Typically, chemo and steroids do very well for these guys. If you're in that other percentage, 20%, maybe pushing into 30 depending on the research, a lot of times those are T-cell lymphomas, and we try and remember that. For T stands for terrible, B stands for better. So we like B-cell lymphomas a lot more. But T-cell lymphomas are very, very difficult and can be very, very challenging, and most of those patients do not do very well. Not to say we can't buy time and manage them, but those patients we're usually referring you to specialists for radiation therapy and a lot of different chemo protocols. So just be careful with that, but feline patients, they do like those two things. There was another study that I read that said they like diabetes as well. I do see diabetes in cats. I feel I see a lot more in dogs. And usually, the most common ones that I see are the kidney failure and cancer in my geriatric felines. So, say your patient has lymphoma. What do? First we got to confirm it and diagnose it. Everybody will go about it a little bit different. Some can do what's called an FNA, so a needle into a tissue, and we find excessive number of lymphocytes or lymphoma cells. Usually we'll go with ultrasound and can lead to biopsies, and then based on the biopsies we get a confirmation and then move forward. So if your feline patient has it, don't be terrified. We do manage a lot of them very well, but cancer is cancer. Cancer does what it wants, when it wants, how it wants, and it does not always read the book. And I can't stress that enough. So just be mindful of it, but there are worse cancers that are way more difficult to manage and way harder. So hope that offers a little bit of encouragement for those geriatric feline owners or moms and dads that get diagnosed with lymphoma. There is hope, but we do have to be realistic still. So on the renal aspect, a lot of these guys, if we'll do our once a year blood work monitoring, we can identify it early. We'll typically get you on a diet, some other supplements, and we can really prolong and do very, very well. It's a little bit more challenging when we identify them late in kidney failure or renal disease, and that does change things quite a bit for us. Not to say there aren't things we can't do, we can, but it all depends on how much damage has been done to those kidneys by the time we identify and manage it. Once those kidney cells are gone, they are gone. The body only produces so many of them, and that's what you got from when they're born to when they die. Kind of like ovaries in females, to give an analogy. So try and stay on top of those. I can't encourage that enough for feline owners, especially when they're geriatric. Stay on top of it once a year, because they can manage it, self-regulate it very well for a very long time until they decompensate and they can't, and that's when they're crashing. preferably we'll catch you guys before you get to the crash and burn report. So hope that helps you guys out, and hope that's something useful for you feline owners, and we will see you guys around. Yeah. Bye guys.